I was
I'd
talking
be
about.
happy to share what late breaking news has been occurring, asymptomatic transmission or lack thereof, what's happened with China today with the accusation that the outbreak actually started in August. There's all kinds of things, whatever you'd like, or I'm happy just to be silent and listen.
Okay, got it.
Mass came up. That was been a big one this week. I'm happy to, wherever you want to
Yeah.
go.
Exactly right. Okay, good. So I will try to do that. I do have something, I have an agenda that I have to pull off before I get to that, and that would be helpful to me. So just wanted to, I guess I'm going to go ahead and start this. Do you have anything to say, Craig, that you want to open up with?
No, just as always, welcome. We appreciate everybody being here, and it should be a great day and a great meeting. So thanks, Paul, for putting it all together, as always.
Okay, good. And then, of course, everybody understand that this is going to go out worldwide. There are a couple of sessions here. I'm going to try something new, which is that everybody be prepared to unmute when I get to certain. We're going to give away some awards today. When we get to certain ones, I may ask you to unmute because you may want to do some applause. It'd be kind of fun, just as long as your backgrounds aren't too noisy wherever you are. So I thought it'd be just something, kind of be a fun new thing to do. It looks like we got quite a quorum here, quorum that's really gathering. So I'll go ahead and get started. So this is a special day because most of you might have been driving in the evening before from the airport in Fort Lauderdale today or last night to go to our annual Eagles meeting. The Eagles meeting would have been held at the Hard Rock Casino. This would have been the first day of Eagle Creek. We would have been gathered by now, going around the room talking about everyone.
So we've got an EPCR which is being
Fiona,
used by
hey Fiona, you're loud. Okay, just Fiona, good, got it. So we would have been gathering right now and going around the room, seeing what everybody was doing and what they were up to, and it's fantastic to see people here around the room, like Stefan Polachek here today. You know, and so on from around the world that was there. So we're going to really miss all you guys not being there today. But this has been a terrific experience, I think. And again, as we said before, people talk about social distancing. This has really been social closening for us, and to be together like this, you know, on a not only weekly basis but a bi-weekly basis has been really terrific, and it's benefited all of us, I think. So I just wanted to say that. So what I wanted to do was start off today with a special thing and sort of maybe have our annual awards be delivered, since we won't be meeting on Friday. And so if I will do this, I'm going to try to do my, I may have to do this myself. Okay, Julian, if you don't mind, because I may have to, you know, do this, the switches, so I'll take care of it. So I lost it here. I'm going to do a screen share here, if you don't mind. Let's see now what happened to it. Okay, screen share, here we go. Share screen. And there it is. Okay, good. So I hope I'm in the right place. Was that?
You've got it. You're up and.
Okay, good. There you go. That's what I want to do. Thank you so much then. All right, so I hope I pulled this off okay. So the first one I wanted to, this was going to be Jeff, as I said, this was originally going to be Jeff Goodlow and I giving us this thing, and Jeff had some really funny remarks to make about each one of these things. We came up with this over the weekend, but this is our seriously important awards that we would have. And the Imago Obscura Award was that person who had the best or most obscure, you know, what do you call it, background, virtual background. And the award this year is going to go to, everybody agreed, David Miramontes for basically blending into sort of like almost a predator-like morphing into the screen a lot and out of the world. So anyways, wanted to make sure that he was acknowledged for best screen backgrounds and all that. The next award we had was a Hail to the Chief Award. This was going to go to Chris Colwell because he had to spend many of his shifts with us here on shift at the San Francisco General Hospital, where he's the chief, and we wanted to make sure he really did his best to try to get online while he was working, etc. The J. Edgar Hoover Award was going to go to Peter Antevy for the most contacts from the FBI regarding his antibody studies, etc. Then, of course, there was the Pregnant Pause Award, where Joelle D'Onofrio actually missed one of our meetings because she decided to have a baby this week. And if you know, got the, did we send the notice out about that, Jim, by the way?
I will send it out today. I couldn't get the pictures across. I'll do it.
Okay, got it. Okay, no problem then. Okay, good. And then we've got the You've Got to Have a Heart Award, because we had to have someone talking about the heart things, and that was to Amal Matu. And the Best Wine Connoisseur Award on the night shift was going to Paul Bailey from Perth, because he would always join us at midnight drinking a good glass of wine, etc. And then, of course, the ODARK 30 Larker Award goes to the person who would have to rise up in the middle of the night to get on the calls with us. And that was Libby Char from Hawaii. So we really appreciate that, Libby. And then finally, the Presidential How Did You Find the Time Award would be going to Pierre Carlis, who somehow found the time with his level of, of commitment to the French government, let alone Paris, was just profound. So we really appreciate that he was able to do that. And I just want you to know, Stefan, you're a close second, so maybe next year we'll see. Then there was the George Clooney Most Likely to Be Cooler Than You Award, and that goes to none other than Glenn Aceto, because we just don't know how he managed to get through all the mayhem and survived all that in New York City, and yet be on the calls with us every week and be as cool as a cucumber. So we just really think we're really privileged to have you there. Then there was the Brimming Petri Dish Award, and what did I was trying to see what Jeff said to me. He says, awarded for the deepest descent into the infectious disease literature while simultaneously having the most screen share errors, goes, of course, to John Jew. So thank you, John, for what you did. Then the Jack of All Trades Award goes to Rob Dunn, because he was appointed now not only to be over the fire department, but also the police department and the transport department, as everything went south in Detroit, etc. And then the I'd Rather Be Sailing Award went to poor Dr. David Pearce, who was both the public health authority as well as the EMS director for the city of Houston, and kept busy as crazy, and did a fantastic job and is still doing it with today's events down there. Rookie of the Year Award, we were actually, I think, maybe a year behind. We wanted to make sure that Erica Carney got recognized for everything she'd been contributing to and her involvement with us, and really appreciate it. And then the Mascot of the Year Award is what I really wanted to put across to everybody. If you had not seen this yet, I wanted to let you know that we have the official Eagles Mascot of the Year. This mascot always wears a mask. He always avoids social contact, usually found in the out-of-hospital setting, and incessantly washes hands, okay? And and then, of course, his name is an anagram for Corona, and that's is the raccoon. So just so you know, so that's our official mascot of the year, etc. So keep that in mind. So one of the things I'm going to do is let me check on this. Our Michael Keyes Copus Award. I'm going to stop screen sharing there for a second. I got to check something out. Yeah, if you don't mind, let's see what it is, 1041. I may want to skip that one and go on to the Pepe Award, the Copus Award. And Sophie, are you there to be able to talk about the Copus Award in a second?
I am.
Yeah,
Yep,
okay.
here.
That one. I'm going to go on to the next one, which is the Pepe Award, because we came up with this, and everybody, I think, overall agreed with this. Craig Manifold, do you want to tell everybody who we ended up picking for that one and why?
No, I'll let you do the honors, Paul. I'm sorry.
Okay. Or how about Jim Augustine? Would you like to do that by any chance? Are you there, Jim?
I'm here. No, I can't do that. Not nearly the justice that you can.
Okay, got it. Well, I can't do it, but anyways, the bottom line is this was completely. It's not only was spontaneous and I mean, let's say unanimous, but it was everybody was telling me that's where it had to go. So the Pepe Award is given to that person who has made the greatest contribution from our point of view to the EMS world in a lot of ways. And there are previous winners that are just amazing when you go through all this and you go through people who have received this award. And but there's a inscription on the plaque, which you will get someday, or the award itself. And it says, what constitutes the dignity of a craft is that it creates a fellowship and that it binds humans together and fashions for them a common language. For there's one variable language, the problem of human relations. And if I sum up those memories that have left me with an enduring savor, if I draw up the balance sheet of my life that have truly counted, truly I find only those that no wealth could have procured me. True riches cannot be bought. One cannot buy the friendship of a companion to whom one is bound forever in common by ordeals suffered in common. And this year's award winner is with completely unanimous choice was Michael Osterholm. So Michael, that's why we wanted you on today. So we know that how much we feel about you and how terrific it's been to have you here with us. And I went back and looked at our February 20th thing. Well, that was our first, and we were way ahead of the curve there, thanks to John Jew and Mike Sayer and you, and the folks in San Antonio as well. So thank you so much for being here, Mike. Okay, so.
Well, thank you. I'm very, very honored. This means a lot coming from this group. Thank you. I have such respect and appreciation for what you do and how you do it.
Well, obviously it's mutually, agreed upon. So everybody can give a universal clap to Michael there.
Thank
Okay?
you.
That's good.
Thanks. That's a big deal.
And Mike, we'll go on to our stuff later because you've got to go if you want to leave us with any words. But I just wanted to make sure that next year we will actually hand you the award in person. We hopefully at the Hard Rock.
Okay.
I'll
be there.
I think it's going to be the second week of June. So that's fantastic. You've been with us for a long time. You've been on our things, and yet here you were when we needed you. You were here, and you gave us guidance really early on. I don't know if anybody else wants to contribute to what I just said, but we are indebted to you forever for a lot of reasons. So anybody else want to pipe in and say anything?
It's fine.
Okay.
Oh, I sure do. This is Jim Augustine. Mike, we wouldn't be anywhere close to the planning capabilities without you. And you kept us not only one step ahead, probably about 5 steps ahead, and credible in our industry. None of that would be possible without you. Thank you so very much. And please keep up that leadership for us.
Okay, so if you have to go now, that's fine. But you want to leave us?
One of the questions I'm getting from a lot of people in the business right now is what's going to happen over the next 3 to 7 weeks.
Okay.
And I think this is where, I've been saying for some time we're in the second inning of a 9-inning game, and I've had more people say, how many damn pitches can you throw in 1 inning? When is it going to go from second to third inning? And I think that the issue we've raised all along is this going to be a wave phenomena that would then give way to a trough of cases, which would suggest an influenza virus like model, which we've never really understood. We surely had some curveballs thrown into this in the last 2 weeks with the whole protest situation and the exposure issues.
Yeah.
And I think the challenge is right now, if you look, we have very divergent issues going on. We have 22 states right now, or cities, territories where cases are going up, 23 where they're actually dropping, and only 6 where they're staying level. And so we see apparently these divergent views. Some of the increase surely can be due to more testing, but I think the challenge is right now, what's going to happen with all the protests? And we have one part of the model that says basically, outdoor air disperses the virus quickly. We see often, little to no transmission in those kinds of settings. We have a situation where, however, in 1918, there were spikes in cases that occurred with war bond parades that were held. So it's not totally absent of outdoors. The other thing, though, we had lots of exposure, tear gas, smoke in some of the cities, ours in particular, where that's an automatic aerosolizing event with the coughing that goes on, yelling, loud voices. And then we saw the situation with arrests and individuals held in buses for hours while waiting for processing and then put in jails overnight. So I think all of us are sitting here saying the next 10 days are going to be very interesting in this country to see whether we see a big increase. If we do, that's not going to be good, but it's going to be what you might expect. If we don't, that's what's going to scare me, is that basically if we are starting to see cases really reduced in the United States over the course of the next 3 to 6 weeks, this is looking more and more like an influenza model and would suggest that we could have one hell of a late summer, early fall. So we'll have to wait and see, but that's the question I keep getting asked, what's in the crystal ball? And right now we just don't know.
So Mike, could you comment on wearing masks, including wearing them in the fire halls?
Yeah, I did a podcast on that last week on our site. And, the question, first of all, is what kind of respiratory protection? And people can confuse all the time N95 respirators, surgical masks, and cloth masks. And let me just suffice it to say that the issue really revolves around what is the source of transmission? Is it droplets? Is it aerosols? That combination of where there really isn't a definitive definition of one or the other. It's just a size issue. And frankly, we've seen for a long time, NIOSH says this themselves, surgical masks are not adequate PPE because of the aerosol issue and so forth in there. And cloth masks are even less. We're actually convening a group of 23 experts internationally who are in industrial hygiene, infection control, respiratory protection, et cetera, to look at this very issue of dose. One of the challenges people have today is that they look at this as a tag, you're now infected. Dose is an exposure over time and amount of virus that's being inhaled. And so all I would say is right now, we have no data that supports that cloth masks, for example, might be a big benefit. Remember, CDC first recommended them without any data to support that they make any difference. It was an initiative put out by the White House. And the whole purpose was to put it on your face. So if you're out in the community and you're in that early stage of developing symptoms, meaning you're asymptomatic yet, that you might trap the larger droplets that come out. That was the whole purpose of this. Nothing's ever changed since then. And yet we've kind of now made it seem like it's a yes or no. If you have one on, you're protected. If you're not, you're not. And so we'll get you more data on this as we go. But I would tell people over and over again, it's distance, distance, distance. That's what really makes the difference. When you're in a fire hall, whatever, it's going to be harder to do it. How much protection you get from these things, I think, are still really a big question. If you want to know just one last piece, which may surprise you, there's only been 3 studies ever done looking at surgical masks and the prevention of post-surgical site infections as a result of what would obviously be respiratory droplet issues. None of the 3 studies found that any of the surgical masks were effective. The rates were the same in those where masks were used and masks weren't. So I think there's a lot we need to learn about masking and what it means. So we'll have more data for you in the near term about this whole issue.
So it strikes me that, Mike, that part of this is intuitive, that it decreases risk, but you shouldn't have a sense that you're protected by it at all in any of these circumstances to some extent, right?
Well, again, it's about what is a droplet. Remember when I cough, I force that into your nose, etc. Okay. I mean, we wouldn't be standing next to people if when we talk all the time, we're automatically projecting droplets into their nasal area, etc., their eyes. So the question is, how has this happened? And what we're trying to do is draw that out using a lot of work from influenza. We have the people who've done the animal model work with SARS already and SARS-CoV-2 that are part of our group. And so we'll get you the best data we can so that you know, am I really making a difference? The one thing I would say, we've done an informal survey on TV, which is the only place safe to do it right now. And we've been monitoring people in the public, any aspect of TV right now. Over 25% of the people we see routinely do not wear the mask over their nose. That's like fixing 3 of the 5 screen doors in your submarine. You know, if you're going to wear it, at least wear it so that basically it gives you some sense of protection. Covering your mouth makes you a bank robber. It doesn't make you a protected person from COVID.
Yeah, absolutely.
Okay.
Well, this has been great. Hey, just
thank you. I'm very honored again. Thank you. This means a lot. You guys are my heroes, and so thank you very, very much.
We'll tell you more about it. Hey, just a personal thing between you and me. I actually need maybe about 3 or 4 more minutes with you sometime.
Okay, Paul, you always get it. You know, as you all know on this call, when Paul Pepe calls you at 10 at night or 2 in the morning or 6 in the morning, who responds? Everybody responds to Paul. I mean, yeah, we all know that.
Thank you very much. Yeah, that guy, especially coming from, as you see, a non-essential person.
Thank you all. I'm very honored.
Hey, Mike, do you have time for one more question by chance?
Sure, I do. Go ahead. Go ahead, please.
First, thanks. We know you hit the big time when you were on the Joe Rogan podcast. That's when my teenager recognized you and thought that was the greatest thing. So, but you know, again, thanks for sharing all your expertise. But the question I have for you is, we have a period right now when we look to the fall and wintertime when we really all anticipate it's going to be pretty rough. Is there an area in our emergency healthcare systems that you think that we can, during this planning time, that we can start to put things in place or mitigate that we haven't already done? What are kind of our weak points that we should be looking at for the fall? Things?
Yeah, you know, I think that first of all, I'm beyond my, I feel like I'm that driver who is in the middle of a winter storm with all the slush kicking up, and my headlights only go about 2 feet in front of my car. They're so dirty. Because I don't know we know is going to happen in the fall. Whether this acts like influenza, whether this continues to be a slow burn, it will continue. I mean, it's going to get to that 60 or 70% population level, and we're only at 5% of the population have been infected. So we surely know we got a long ways to go. Vaccines are not going to come nearly as quickly as a lot of people think. So my answer to you is that as of this morning, there are at least, and I say least, 687 healthcare workers in this country who have died from COVID-19 infection. and at least 2/3 of those are occupational related. So if we have any lull at all this summer, the key thing is build up on PPE. You know, I can't say that enough, because if we get into a big surge in the fall, you know, there's nothing worse than you all being at risk for what you're doing. And so if I had to say one thing, I would say work like hell to get as much PPE as you can get and have it stocked, piled, ready to go if we do see a big burst in cases. Protecting you is the most important thing we can do right now to protect the public, protecting you.
Hey, Mike, Eric Topol and a couple others put out a thing in the Annals of Internal Medicine. I don't know if you saw it, where they were saying,
I actually have a call with Eric in an hour. I have seen it. Yep.
So do you think that's true, that 40–50%? Because that's what they found in Iceland as well. What do you think?
Well, you know, this has been one of the challenges, what WHO put out yesterday about how many are really asymptomatic and how much is it a test issue, how much of it's an actual real issue. And so clearly where we've had some of these studies, we see people who do ultimately become symptomatic. For example, one of the studies Eric cites, the group, nobody had any symptoms, and yet 10 of them on radiographs, they x-rayed them, had the classic broken glass lung picture. Now, tell me, how can you have radiologic changes in your lungs like that and yet call yourself asymptomatic? So I think one of the challenges has been, what does asymptomatic mean, or what does pre-symptomatic mean? And that's in that paper, and that's what Eric and I are actually having that discussion about today.
I love the thing about the sewage in Miami, where they were able to, to look at that, and I think that was pretty cool too.
Yeah.
So everybody.
Well, I have to run here. I'm sharing another one, but I thank you all very, very much. It means a great deal to be associated with you. It's one of the greatest honors in my career to be part of this group. I mean,
you get 5 minutes. Call me later this afternoon. See you later.
I will do that. Okay. See you later. Thanks, everybody.
All right.
Bye.
You. All right. So listen, that was great. Hey, so I want to move on. Unless anybody else has a particular question for me, I want to move on to a couple more of our awards that we have. We should be finished here in a second. So anyways, we just saw that. Let me see if I can do my screen sharing thing here again, if I can. Okay. That's the thing. Because I want to control this thing a little bit. Okay, here's my screen sharing, right? I hope I'm doing it here. And then I get to this. You guys can see my screen okay? I assume. Okay, can you see this okay? The Pepe Award?
Yes. You're fine, good.
So there's those to home. Okay, the next award that we have is in honor of Michael Kopis. So for, I don't know if any of you can, I probably can't see what I have up right now. I got Portable 55, which is the Holy Grail. Mike is really the person that really was the ultimate role model, I think, that we all want to achieve. I look at him as the Holy Grail of medical directors, and now we're into the 4th or 5th generation. Several of us, you know, whether it was Terry Valenzuela, Art Kellerman, a few others actually got to work with him directly. And then we've had our own proteges that learned some of the lessons from him. And so this is an internal award that we give away to the person we think epitomizes, you know, mostly what we're all about. And every year we try to get someone, especially who's been proving it for many years. Sophie Dyer, are you there? You might want to help us out with this one, because it was a real hard one, right? So just being sarcastic.
Hey, Paul.
All right, Sophie Dyer from Boston, by the way, everybody, if you don't remember her, she's a really smart person up in Boston, and she's been really busy, and she has this you know, really heavy duty meeting that happens every Tuesday, and they finally let it up, so she's free to be with us today, so we welcome her back, so it's great. So Libby, Sophie, can you maybe give us a little bit of insight to the person who we're going to pick this year, and tell us about that?
Absolutely, Paul. It's my great pleasure to be here with everyone. I've missed you all very, very much, but thankfully things are a little bit kind of loosening up here in Boston, so I'm able to join. So the Kopis Award is really kind of our highest award for Dr. Michael Kopis, who was a consummate EMS physician, consummate professional, really well respected by everyone. And our award recipient today hits all of those things. She is a leader in her state for decades, making care better for citizens and millions of visitors. I also know this award winner very well. I consider her a colleague and a friend. She is smart. She is a consummate professional, kind, and really reflecting Dr. Kopis, held in incredibly high regard by all of her colleagues, including us. Dr. Libby Char. Congratulations.
Congratulations, Libby. That's great. Fantastic.
Yay!
Yay.
So well deserved, Libby. Congratulations.
We just, yeah. We're just glad we just wish we were all together today. It would have been a great thing to have us all together. But at least we want you to know, we're going to officially get you the physical award next year at the next meeting. We hopefully will be together around this time, actually about a week later. It looks like we may have an arrival date of about June 14th, the way we think we have a potential setup already at the same place. And thanks to Don DiPetrillo. And so we'll see how that goes, but hopefully we'll all be together a year from now, in a year and a week anyway. So with that, so thanks. Libby, can you say anything, or are you going to be your usual humble self?
Oh, I'm floored. I don't think I'm deserving of this, but thank you so much to everybody. I think I'm the lucky one, just getting to connect with y'all and learn from what everybody else is doing and all the great things everybody else is doing. I really am indebted to y'all, so thank you.
Yeah, and so we can't thank you enough. And how many years have you been doing this now, Libby?
Oh my gosh, 1998.
Wow, it's just amazing. So my math is really bad, but that's over 2 decades, it seems like, right? So that's
wow,
it.
Thank you very much, everybody. Thank you.
All right, well, good. It's fantastic having you on board. So let's move on. I just do, let me see. Hey, by any chance, Sandy Schneider, are you there by any chance? I think Sandy was on. Hope, yeah, you're there, right, Sandy?
I'm here. Sorry.
Hey, would you be in a position, since you're a previous winner of this award, I thought maybe you might be able to say something about this year's award winner, okay?
Okay, but you didn't tell me who it was.
Okay, I will announce it. Well, first of all, I don't know if Jeff Goodlow's there or anybody else from Parkland, et cetera, and that range is here, but Ron Anderson was probably the best known CEO in the country of any, just a beloved in the public health realm. And he was not only an internal medicine who became an emergency physician, but he became the CEO of Parkland Hospital and stayed in that position for over a quarter of a century. Just had an incredible job, and he was just the spirit and just of doing great public health service for the community. Just one of the people who was just admired by every person, et cetera, for his work, and just renowned for that. And we want to keep his memory going. Many of you have met him and knew how cool he was. And then the winner of this award was someone you and I discussed it, but I'll just go ahead and put it out, and then you can talk a little bit about it if you don't mind, and tell us the rationale for this, Sandy, okay? And that's John Kramer, okay? John, you're there today, right? So.
Hey, John. Yeah, he asked me how I'd known you and whether I'd known you, but he didn't tell me you were getting the award, which is classic Paul Pepe, to give you all the lead up, but without it. So let me say 2 things. First, let me just say something about Ron Anderson, and that is, I had the privilege of meeting him. I never worked with him, but he was just an incredible individual. And then John, what can I say about a guy who keeps getting recycled with me? Every time I turn around, he's got a different position and I have a different position. But I first met John at the NAMSP meeting. I think it may have been the very first one, and I believe we served on the initial board together. He has been both a person who has devoted his life to EMS, but now to government service. And his work in the government service has been a lot behind the scenes, but accomplished so much for us. And so I think this is absolutely fitting. He is the epitome of Ron Anderson, someone who works behind the scene, who doesn't come out very often and toot his own whole horn, but manages to bring people together. I will tell you one very quick story about John. Most recently, he was faced with a group of surgeons who wanted to create a rapid response team to go to various places that were in disaster areas. And he asked me to be on this group to represent emergency medicine. And I am like, I don't think they were going to take a group of retired surgeons, I believe, to respond to these. And I'm like, I'm not sure a group of retired surgeons are exactly what they need on the front line of many of these disasters. They really need us. And John was masterful, making them feel somehow important at the same time, making them realize that their role was going to be secondary to emergency medicine. So an amazing negotiator, an amazing human being, and a guy who, again, I hope we continue to be recycled into different positions and continue to work together. Congratulations, John.
Thank you, John. I hope you can say a few words for us as best you can.
Thank you, Sandy, and thank you, Paul and the Eagles. This is a great surprise and a great honor. I did have the opportunity on several occasions to work with Ron on several projects, and the comments that you made, Paul, were spot on. So thank you. I'm very honored.
You're very surprised because I asked you to give a report today, right? That's why I had to make sure you're on. That's the reason. Now you know why, okay? So we'll talk later, John, and thank you and congratulations for everything you're doing for us. And he said in some respects, he's at the highest level of EMS in the country as being the director of the Office of Emergency Medical Services at NHTSA. And but he's been held a lot of other important positions over the years. And so we're just really great that you're there, and it's made a terrific difference. So we all admire you, and thank you for your friendship. We treasure it. So thank you so much. And thanks for being here and being part of us all the time. It's been wonderful to have you there. Okay.
Thank you all very much.
Okay. Yeah, that's right. A little clap in there. And then anybody else wanted to say something before we move on to the next one? Okay, if not, thank you, Sandy, by the way. And great, Sandy, any report from you or anything we need to know about? Things are kind of quiet at this point. Not much has changed since last week, right, from what I understand.
Unmute, okay. No, just again, the webinar on the 11th on setting up a buddy system. Please sign up for that. If I get a chance, I'll put it in the chat. But please sign up or get someone from your system to sign up. It really is important. Thanks.
Okay, fantastic there. Okay, good. Hey, next person I want to call up is Corey Slovis, if you don't mind, Corey, because we have next award is actually in your name from what I remember, right? And so there's John Kramer. I'm going to move on. So the Corey Slovis Award is given to someone who can, like, put two sentences together. Is that right? Is that what it's about? As everybody knows,
being able to give you enough money to finally get this award named after me.
Yeah.
I'm very humbled by it.
Yeah, Corey, everybody knows Corey Slovis. Let me just say, we don't even have to say it because everybody knows he's the master educator, just an incredible person. He only knows 5 things, though. He still is the quintessential speaker. And so I think he's the perfect person to give this award away this year for the best educator that we have out there. Go ahead, Corey, hit it.
Well, Paul, let me again thank you. And please know I might joke about it, but I'm so honored to have my name affixed to an educational award. And so this year's educator didn't start out as one. He started out as a clinician, not that there's anything wrong with that. but he has transformed himself from being a full-time clinician to becoming a full-time clinician, full-time educator, and now also a basic science researcher, someone who directs as EMS medical director for the state of Florida, someone who teaches, it appears to be 25 or 26 hours a day, Dr. Ken Shepke. Ken, you wear it well.
That's great. Okay, so congratulations, Ken. And there was, again, everybody was almost, again, a universal, all these award winners, it was like, it seemed like everybody was totally on board. And I independently asked over close to 20, 30 people what they thought, and almost everybody came up with the same people we picked this year. And there was, just, it was fantastic. So thank you, Ken. So it's well-deserved and all that. I don't know if you have any words or we put you in an awkward position, but I'm glad you're there. Ken, I thought, hey, Ken, are you there? Hope we didn't miss that because I had him online here. So at 11 o'clock. Ken, are you there? Okay, well, we'll let him know later on.
No, it's user error on my part there. Can you hear me now?
Yes.
Yeah, so I was just saying an immense, enormous honor to have anything attached to be associated with Corey's name. Corey is literally world renowned as a fantastic educator. I'm very humbled and honored by this. Thank you so much to all of you for this. I don't even have the words to say. It's a complete shock and a true honor. Thank you so much.
Okay, good. Hey, it looks like you're in the CNN newsroom. Is that right?
Almost. That's our emergency operations center in Florida.
In Tallahassee. Yeah. Okay. Fantastic. Then.
Yeah.
And we'll talk later. But congratulations. It's fantastic that you're there.
Thank you so much. Appreciate it.
All right. So that's all. That's all I have again from our end and all that. And yeah, I don't know if you're up for it or not. Jerry, you're there. You want to go ahead and say a couple words? You asked me if you'd like to do that. And I won't say anything about background or put you on the spot, but are you there, Jerry Meltzer?
I am. Thank you, Doctor. Good morning from Scottsdale, Arizona. Listening to all the awards that were given today, if I might just please offer a virtual participation award for all of the Eagles. For those of you that I've not met in person, I represent a company called Team Sequel. Team Sequel is a health and security management firm that services the live event industry. And we've had the good fortune of Dr. Pepe's guidance over the last decade or so and have surely benefited from all the wealth of information that the Eagles provide. I don't normally get the opportunity to join you live, and it's a great honor for me today to be here. For those of you that didn't receive an award today, I'd like to reach out and offer a virtual participation award for everyone and just tell you that the information that we receive here is so beneficial to us and our best practices, solutions, and I'm grateful for the opportunity to join you today. Thank you, Doctor.
No, you're very welcome, Jerry. And thank you for everything you do. You're a master at your job. Many of you met him on the road, whether we were with, I don't know if I should mention any of the groups or not, but Jerry, because I don't want to put you on the spot. Many of you met him over the years as we went through things, and no one appreciates more the work that the Eagles do, particularly as we move through a challenge preparing for mass gatherings, an event in case there is an event where there is a multiple casualty incident or something happens to one of our principals, or more importantly, our beloved crew that we were with. And this is on various things, and doing a medical advance work has just been totally beneficial to his team. And so, but that only has happened because of the Eagles, and not just here in the United States, but across the globe as well. So I think that's the reason why he wanted to pop in and say something. They've been monitoring this, right, Jerry? You've been monitoring most of these calls that we have, correct?
From the get-go. It's just my first opportunity to join you live.
Okay, good. All right, fantastic then. All right, well, speaking of the world, one of the people you met some time ago was about a year and a half ago was Stefan Polacek from Berlin. And Stefan, do you want to give us an update of what's happened in Berlin and over in Germany? Give you a second.
Yeah, that's hi everybody. That's very easy. We have released completely now the shutdown, and we have very low numbers, and so we are dealing at the moment with just all other stuff than COVID at the moment. So the most of the time. That's
okay.
all. Thank you.
No, that's good then. I'm just glad. Again, you were a close runner-up for being the How Did You Find Time for Us award, that kind of thing. So that's all I can say. So good to hear you from there. Want to move on to New York City and see what's so were you, Glenn, were able to hear how you got the George Clooney Award today? I'll give Glenn a second to get on, so because he's like the world's busiest guy.
Hey, I did. Thank you very much. Really awesome. Really some awesome awards there. Thank you. Okay. Everyone's doing well. Nothing much has changed for us over the week. Our volume started to slowly creep up a bit, but we're still about 15% below our normal 4,200 call volume. So things are normalizing. Phase one for us began yesterday. I expected a little bit of a peak, but still people are staying home, it looks like. Our subway systems are fully operational now. The number was surprising to me. Pre-COVID, on a normal daily basis, the New York City subway system moves 8.3 million people a day. I was shocked to hear that number, which, our city population is about 8.5 million, so that's amazing. Supposedly 400,000 people started to come back to work, but it still seems that volume is a little bit low. As with everywhere else, protests are still going on. Our curfew was implemented in New York City, which hadn't happened since World War II, apparently. But luckily, the looting and such had stopped over the last couple of days. So we're kind of getting back to normal, getting ready for a potential second wave.
Yeah. And I think it's kind of interesting the things that, you know, watch TV and they showed a lot of what you were doing there, you were encountering in your arena. And the issue that you are in the outdoors area and you're shouting, you know, and then of course with tear gas in some places you're coughing, that there may be some exposure. Again, that's balanced with the outside world. And then the other thing is that as the second wave comes, I think it's because people have relaxed up. But still, I think there's a large part of the population that hasn't relaxed as much, and they're doing a pretty good job. And so I don't know, it'll be interesting to see how hard it hits us. That's my opinion. So, and I'm sticking to it.
Agree.
So what do you think, Glenn, on your end? What are you guys, or what are you hearing or thinking? And by the way, I heard the governor took the subway, right? Is that happened today? Did that happen?
He did, yeah. Yesterday, you know, he had promised one of the local news reporters that he was going to take the subway when it opened, and sure enough, he was on there. And the reporter kept saying, I didn't, you know, they didn't choose the car. I chose the car. Much cleaner than it normally is. People are shocked going back because they haven't been on the subway going, we've never seen it as clean as it is. But he was definitely on board there. And, you know, it's trying to get back to as normal as possible. But we're the last area in New York State to implement phase 1. Some areas have already implemented phase 2. And then hopefully phase 3 will be soon thereafter.
Yeah. Okay, good. Well, thank you so much. I was looking around right now for Joelle Zanofrio to see if she was on the line. I suspect she's not. On June 2nd, she gave birth, as you probably heard, as from my Pregnant Pause Award for her, to a baby girl, and she's doing really great. And we're going to have some pictures sent out, I think, today. Jim's going to help us do that. I just want to make sure we didn't lose that in the mix here. It's been fantastic having her on board because she's given us great perspectives, not only on children and neonates, but pregnancy as well during this past presentations that we've done. So, okay, let me move on. Hey, John, just so you know, John Kramer, you're live just because you pop in and out, so just so you know that. Okay. Let's see. I'm trying to move on to some people who we haven't talked to. There, I saw. I was trying to figure out who some of the names were. Jim, do you have a report from us from the IAFC and IAF lands firefighter world?
Yeah, everybody is very concerned on the civil unrest side and what that means. Very important that we all participate in this process of we're not the enemy in terms of the danger to our fire EMS people during civil unrest times. That is a large concern and still is. Second is that PPE issue that the IAFF in particular has gone to bat for the industry to say that we need to make sure that we sit high on the priority list for PPE as it gets distributed for the fall. As of right now, the top 3 priorities for PPE distribution are hospitals, nursing homes and congregate facilities, and public safety responders. So keep that in mind as decisions are being made locally, and people like Ken Shepke are responsible for contributing to that, John Kramer as well. So we have to be cognizant of that. The other issue that is coming up is medication shortages. That problem, unfortunately, is not going to go away and frankly could get significantly worse in the fall. And so all of you should be prepared with your logistics people in having those discussions. Paul, that's it. Appreciate your leadership. We need an award for you every year for putting us together and for contributing all you do. The late night award belongs to you because your agenda usually comes out about 4 in the morning. I don't know how you burn the clock at all 3 ends. So thanks, Paul.
Yeah, the funny part was this slideshow was putting together at about, I'd say, 35 minutes before because I was waiting to get a hold of Jeff to figure out how we were going to do this. So I figured I'd go with the slideshow. And so it was, I have to say, I'm glad to see even at my age, I still got it in me to stay up all night. Yeah. So it's good.
You're the O Dark 30 guy. Thank you.
Yeah.
Well, Paul, add into Jim's comments on the medication shortage issue.
Yes,
this is really just for awareness out there. BARDA, one of the governmental entities, just provided to Virginia Commonwealth University and some equity companies over $6 million to address the generic medication, generic injectable drug issue. And so it's in the development. It's certainly not going to be something that's going to be solved by this fall, but they're doing that. And I'm also helping with a company that's looking again with American manufacturing processes for generic injectables. And so between those two groups, we'll probably be relying heavily on this group for feedback, helping to look at, you know, what are the essential medications that we want to look at and prioritize, and then also concentrations. It's obviously easier to do it if it's just in a single concentration versus trying to meet many medical components with that. So again, some good news for the future, but it's going to take a while to get there with these private companies. But people have heard the issue and are trying to address it. So thanks.
All right, great. Anybody else have anything to add on to Jim's comments before I go on to the next person? And I don't hope I'm not catching you off guard, Sophie, Sophia Dyer, if you can, I'd like to get you back on again because you've been tied up every week, I wanted to get a report from Boston. You've done some unique things, and we talked about this early on, including hiring an infectious disease person to help you out within the Boston EMS, and as well as some of the other practitioners that you've done, and some of the really cool things you've done about tracking down exposure. So can you want to give us a little bit of insight about what's happening in your realm and what you're up to?
Yeah, thanks very much, Paul. Sorry I haven't been able to join everyone in person, but I've been keeping an eye on things from the available recordings. So it's great to be here in person. Like a lot of cities on the East Coast, we did have a significant impact from COVID. Massachusetts, I think, is still number 3 in terms of cases, well over 100,000. And kind of tragically, many thousands of people died in our state, including within our city. So for that, we are sad, but hopefully kind of continuing to move forward. So as Paul kind of teed up, I was really grateful to get a lot of support from our Public Health Commission. We're a division of our Public Health Commission. And early on, I knew this was going to be, a lot of focus was going to have to be on provider safety. And so we had some great partners. I was able to hire a retired infectious disease consultant for us, and also get some nurses from school-based health who are awesome nurse practitioners. We did follow up on every potential exposure, comparing it to our database just to see if the person that our crews transported ended up with COVID. We also had some really great partners. We had a partner at MIT who started up a chatbot for us so that our providers have a check-in every day, 30 minutes before their shift, just to review if they have any COVID symptoms. And we've put together very rapid testing availability for anybody that kind of raised their hands and had symptoms. And the people have been really very responsible about raising their hands and saying that they have some symptoms, so that we've been able to take them out of the workforce until we have some time to kind of figure out what their symptoms suggest. So, but we are definitely not letting grass grow under our feet. Things have slowed down a little bit in terms of number of COVIDs. We're in phase 2 of reopening, so some dental services, some healthcare services, our ICUs, and we have most of the ICU beds for the Commonwealth of Massachusetts, really stepped up and had incredible surge plans, and were able to kind of keep going despite all the challenges. So for those folks, we are grateful for all their contributions. And again, we're at phase 2, opening up. Some people are able to get some dental care, some other kind of non-scheduled care. The other thing we did is really kind of hopped on telemedicine quickly and rapidly put up a telemedicine program that we're kind of evaluating now. But we're continuing to move forward.
So that's great. This has really been helpful because it just adds some more to our portfolio of things that we can do. And once somebody's doing it, then we can always go back to our city managers or whomever and, and say, hey, they're doing that in Boston. Why aren't we doing it here? So that's worked out really well for a lot of us in what we call the R&D department, rip off and duplicate. And it's good when someone's got a good model working, and like you did. So thank you once again, by the way, for your usual incredible contributions. Okay, so thank you. And by the way, we do, Sylvie, I have a special thanks again, because in lieu of, saw Jerry Meltzer there before, that for always being there to help me out when I couldn't be in Boston, wouldn't help us with our cruise. And so those guys are incredibly grateful, and they all loved you a lot. So thanks again. We'll talk later, okay? Anything else? Anybody have any questions of Sophie before I go? On to the next person. Okay. Well, let me just jump around and talk to a couple people that we may not have talked to for a couple weeks or so on. And Dustin Calhoun, can you tell us a little bit what's happening in your neck of the woods? And how you're doing?
Doing well here, actually. Cincinnati has probably of most of the cities represented here had some of the least impact, which we'd like to take some credit for that, but probably not. The biggest battle I'm fighting right now is because of how protected we seem to have been so far. I'm seeing a lot of pushback from the fire department with regards to trying to start minimizing the use of PPE. Because we've moved, like most people, to using PPE appropriately on all patients, and they're wanting to start culling some of those patients out of there and finding who it is that they don't need to wear it on. And that's becoming an interesting battle. So as I'm fighting that fairly well right now, but as it gets further along, I feel that I may reach out and look for how others have managed to push that. But beyond that, we're helping with the community as far as moving into trying to do community testing based on state and federal guidelines. Great appreciation to Mark for some of the information about what's going on in LA there. I got some false information about what they were doing through our health department, and it was great for that resource for him to be able to help correct some of that for us.
Good. All right, fantastic then. I think what I'll do is, if there's nothing else from you, I'll move over to St. Paul. And obviously that's been a kind of a ground zero for a lot of things up there in Minneapolis and St. Paul. And to get a report from RJ Frescone, one of our people who, like about a half a century ago, won the Copus Award, right? How long have you been at this now, RJ? How many years is this now for you?
I was thinking about that. I think it's around, let's see, 37 years.
Yeah, you're too old to remember, right? Well, that's fantastic then. 37 years. Okay, good. Well, welcome back, my friends, to the show that never ends, right? And tell us what's the latest in your area.
Well, our numbers are still just creeping up slowly, very, very slowly. St. Paul is not going to dismantle its police department.
Okay.
Our sister city plans on doing so. Maybe we'll have an invasion of Minneapolitans to come over for safety when that happens. I don't know.
Yeah. Okay.
Really, there's not much going on. We're just waiting for that second wave.
That's kind of good news. Hey, Fiona Moore was on from the UK. Fiona, are you there still? I don't know if you had to get off or not. You may have had to. Just want to see if you're on. Please go ahead and chime in. Sorry we missed her. She's always terrific to listen to. Then if I can't hear her or don't see her getting on anymore, sorry we missed her. It was great. Then let's go down to Chris Zuber, because things are percolating down in your area of the woods, right? Chris Zuber in Orlando.
Hey, Paul. Yeah, we're perking up a little bit in terms of, I think, positive tests as well. We also, our call volumes, of course, like many places, are starting to increase. We had a relatively, I think, non-violent protest period as well. It's been a while since I've been able to call in. We've been tagged essentially with a lot of the public health functions for Orange County in terms of testing, PPE distribution, and a lot of stuff like that. So we're definitely keeping busy. We're glad to see volumes are slowly trickling up in the EDs. I think, like a lot of places, acuity subjectively seems a lot higher than we had seen during the during our peak phase. We're in phase 2 here in Orlando, so we're starting to see the parks are opening.
Yeah, that's what I was going to ask you about. That's going to be interesting. So let me interrupt you for a second, just so you know. Chris has an incredible jurisdiction in this sense. Not only has Orlando, but I don't know how many surrounding fire districts and all that. within one of which is an independent fire district called Reedy Creek that's responsible for the Disney properties, right? And there are some plans to open up things like the SPN Center and all that. So you have some interesting challenges ahead, or at least a new configuration that you're going to have to deal with, correct?
That's right. You know, we cover as part of our area is we cover Universal, excuse me, SeaWorld, as well as all the Disney properties. And Universal opened last week on Friday, I believe. They started, and they're lower capacity, requiring face coverings, and some increased sanitation of rides. But the City Walk, so the restaurant area, had opened a couple weeks before that for lower numbers. We have SeaWorld coming next, which has modified their schedule. They're going to be a Monday through Friday operation, and then going into July, we'll see Disney opening, and we'll start with the Magic Kingdom and Animal Kingdom, and then followed shortly after by the other parks. They're still not really full capacity with the hotels, of course. The park entry is going to be, they say if you've ever been to Disney and you walk in around 8 o'clock in the morning right when it opens, they tell us that's going to be in the beginning, that's as crowded as it's going to get. So you won't see the mass crowds. Face coverings are going to be on required for use as well. And we got a sneak peek tour of kind of the process they going to follow, and it'll be interesting to see how that rolls out. It's going to be reservation based only, essential, just to come in to the parks. And if you end up staying at a Disney hotel once they're up and operational, there's no guarantee you'll get into the park, they claim. Additionally, our convention center, which I think is only second to Las Vegas, in the next few weeks, they are going to start slowly kind of opening up. We have some volleyball tournaments coming in. And Wild World of Sports, anyone who's been out there, it's a very large athletic complex. There's multiple professional athletic associations which are looking to initiate their seasons there with a closed tournament based. Both I know Major League Soccer is looking at it, as well as the NBA.
Okay, got it. All right. Well, listen, thank you so much for the report. Anybody have any questions for Chris by any chance while we got him on the phone? If not, give our best to Alex as well, and we'll hopefully see us sometime soon. I'm hoping to make it down there and visit with you soon. So thank you so much then for everything you're doing. Keep me abreast of what's going on while you're down there. I wanted to see if John Jew is there. John, anything happening in your world? And congratulations on the Petri Dish Award, right?
Thanks, Paul. No, we're about the same right now. We're expecting an outbreak. In fact, we've had a major outbreak of one of our seafood processing plants, and we're seeing a pattern of large agriculture or large congregate outbreaks right now, and moved from a community outbreak to a large congregate outbreaks. Other than that, we've been pretty lucky, like Cincinnati, that our rates are low, but I expect a second wave probably earlier in July because of the protest demonstrations, et cetera. But we're doing well.
Yeah. Okay, good. And nothing new to report from the infectious disease world. Do you have anything new that we need to know about? And did you see the report that we were talking about today, Mike Osterholm from Eric Topol and all those guys, about thinking that there's many as 40 or 50% of the people are asymptomatic?
Yeah, in fact, you know, I was a little bit late. The WHO, she's actually quite good. She's walked back on her statement about asymptomatic spread, and I personally believe in asymptomatic spread here as well, and hence the whole discussion about mask. We're having the same challenges about the mask with our fire department here, but I keep reinforcing and sending them patients who are known to be COVID positive that we've transported or are treating, and that seemed to quiet down some of the pushback that we've seen from our providers. I'm getting a quote unquote COVID fatigue syndrome, where people are getting tired of this and they're trying to be lax on their PPE.
Yeah. We've seen CFS here as well. So it's a mounting disease process itself. Hey, John, just again, I wanted to thank you always for being, I went back and looked at your first report. You were our lead off for this series on February 20th, and it was fantastic at that time even. And just going back and looking at it. What's interesting is that Mike on that thing was reporting that they had their first reported case. This is just an interesting perspective of why the things may not get heated up for another 3 or 4 weeks or whatever. We had our first reported case in the United States on January 19th, confirmed in Snohomish, Washington, not too far away from you. And so it was interesting. I went back and looked at how many people had died. Now, it takes you a little bit of time to die because you get the disease within whatever, on the average, 4 or 5 days after you had your exposure. Then you go through about a week or so, maybe on day 8 or 9, you crash, 10, and then you go into the ICU, and then you're there for about 3 weeks and you die or whatever it may be. And so it takes at least a month from the time you were exposed, oftentimes, to have deaths occur. But I was because of that, I was tracking the deaths, because that's the best thing, because you don't know what the thing. But you know how many deaths we had as of March 2nd in the United States?
Probably less than 5, I think.
You're exactly right. There were 2 deaths on March 1st, because that was the day we were all going to EMS today, or many of us were, and got together there. That's the day I arrived there, and we had our first cases reporting in Tampa at that time. There were 3 people that they had confirmed. By April 1st, what do you think happened then? We were still only up to about 1,900 on April 1st, and everybody knows what's happened, well over 100,000 by June 1st. So it just takes some time for for this thing to sort of spread, as Mike said. And I went back to those first calls, and it was amazing, because it was very interesting to see how that went. And so that's why. Do you have the same concerns as me that it's going to start really percolating up maybe in a few weeks?
Yeah, I do. I have utmost respect for Mike Osterholm, and looking back on my own notes, I actually, at our operations meeting on January 2nd, noticed that Wuhan, the outbreak, that was on my radar. And I figured that's really strange. That doesn't really happen. And basically it was on my target list. So I really want to say kudos to Mike Osterholm. He's got it in his DNA. And there's the reading the tea leaf issue. That when it smells bad, for people from Mike's perspective, it probably is worth paying attention to.
Right. It's a spidey sense. Now, as I said, it could be that because some people, or at least, and particularly most of the most vulnerable people, are paying attention to it a little bit and distancing to some extent and wearing masks, et cetera. Maybe, there will be some mitigation, but, I don't know. We'll just have to see. This is a dangerous disease. All right. So thank you, as usual, for your work. John, how long have you been doing it there? How long have you been in Portland being the medical director?
Well, I was county medical director in 1995, but I started in 1988 as Portland Fire's medical director.
Wow. So that's like before most of the people on the phone were born even. So that's impressive.
Yeah. I basically remembered people that said, well, we have a whole bunch of residents that, well, we're not going to survive. So I've been through this, been through the 60s and the 68 with the Vietnam War and I was in Detroit when the outbreak, actually the civil disturbance outbreak, and basically Detroit lost control of the city as well. And so I said, just hang on, we'll figure this out here as well. So it's happened before.
That sounds great. So, hey, what I want to do is, if you don't mind, I'll leave you, John. And then I saw Remley Crow got on the line now. Remley's been with us in the past, and we had one time thought about her as like one of our mascots as well, but she was just too incredibly smart to be a human, human beings. And so, by the way, we want to acknowledge that for those of you who didn't know, that Remley won the Best Research Award at NMSP this year, and just really great to have you on board. Remley, do you have anything new from the world that you're doing? You're doing all this research for ESO now. Anything new to report for us, or we should know about, or anything on the radar screen?
Oh, well, thank you for the great intro. Something that we do is we've been doing surveillance on the EMS data from ESO, and so that is, I can post a link in the chat. We're still seeing ILI drop, and we're also seeing the 911 records drop, but overall 911 volume seems to be picking back up. And that's consistent with what you all see.
Okay, nationwide. So, hey, tell us real quickly what your presentation that won the award at NAMSP. What was that about?
Oh, I might become unpopular. Okay, here we go.
Okay, never mind then. We'll skip that. Okay.
Just kidding. Comparing stroke scales. So we looked at the Cincinnati pre-hospital stroke scale from speech compared to the race lambs and van, and found that there was no difference in the ability to detect large vessel occlusion.
Yeah. Well, at least within the group that you were looking at, but that was fantastic. And I think congratulations on the great work that you did and so on. And by the way, I have to personally thank you for, I apparently got a promotion because originally you set me up to be only insignificant, but now I'm just non-essential. Is that correct? So
that's what I heard on the streets.
Yeah. So just to let you know, I want to give the credit to Remley for providing me with my my attire. So thank you so much, Remley, as usual. Okay. All right. So hey, Andy Garrett, anything going on in your world that you want to report on for us? I don't know if you're Andy, if you're still on or not. There, I see your name. You may just have to unmute, right? So Andy, as you know, is a past director of NDMS, National Disaster Medical System, is now over there working part-time at HHS. And Andy, anything to report? Well, if we may have lost him or he's off being distracted somewhere. Hopefully he'll pipe in here in a second. Just cut in anytime you want if you get to hear this, okay? Hear this that I'm saying here, Andy. So, all right. Let's see. I think we've pretty much talked to everybody else recently. Anything from the world of Florida that we should hear? Because we haven't talked to you for a while, Peter Antebi.
Hey, Paul. Hey, thanks for having me here. Yeah, we're doing good here.
Hey, Peter, and congratulations on your J. Edgar Hoover Award. I just want you to know. How many times did the FBI contact you? That's what I want to know.
They have my number on speed dial, unfortunately. But speaking of FBI and testing, so we are, as you know, you're one of the major researchers with us here, but we now have a 7-city study going on, a longitudinal study. We'll be testing 15,000 people. We've already done the first round of testing, and the positivity rate is only 1.5%. That's somewhere in the average there. We haven't done all the number crunching, but we're getting about 1 to 1.5 patients per 100 positive on the CellX antibody test. Mm-hmm. We also finalized the executive summary on the CellX validation, thanks to you, Paul, and your tremendous writing ability. We got that to the state level, which is now at the FDA level. Other than that, we're talking about the same issues that people are talking about with PPE. We're getting clamors for people to stop wearing the Tyvek suits. They want to move to gowns. We're working on that. We also today are testing an entire nursing home, both with PCR and with the Siemens antibody test, and it's all for free because Medicare pays for it. So we'll have some results this week on a large nursing home, just getting everyone tested at no cost. So we're trying some innovative things. And then the last thing is EMS education. We have 2 large schools here that Paul, you and I have. And we've created some policies to try and reintegrate them back into both clinical and field. And so that's moving along as well. So that's it from Florida, and thanks everyone.
Okay, I'm going to jump around again. And Rob Lowe, since you are a victim of aforementioned disease, you're doing well, I assume, and you're recovering. And are you antibody positive? I just want to know, Peter just talked to us about testing.
I'm doing well. I have not antibody tested yet. It's actually something I'm looking towards doing for the whole department, so we'll see how that goes. But yeah, I'm doing well. I'm back to work, and same battles as the rest of you. People want to start stepping down and figuring out how to get out of PPE and stuff like that. And so we're just trying to figure out how to manage our own internal demobilization, reopening, whatever you want to call it.
Yeah. Okay, got it. Okay, good. But you sound well, so I'm really happy. And that's the main thing I wanted to know amongst us here. Hey, Crawford Meacham, up in Philadelphia, I was thinking about a Philadelphia is Ready When You Are award, because you were always the people that were going to be brave. So I didn't get a chance to put it all in. I was putting this stuff down at the last minute, all these awards that I came up with. But we wanted to recognize you for being there in case that New Jersey and New York imploded more than it did. So what's happening in Philly? You've got a lot of challenges there on the law enforcement end, right?
Yeah, actually, yeah, we do. But that sort of everything is sort of quieted down. The fire headquarters is still surrounded by National Guard soldiers and police 24 hours a day. But from the point of view of protests, they've settled down, and we certainly haven't had the repeat of last weekend's issues that the city was facing. And regarding COVID, sort of the same lull, the same, I think, COVID fatigue that other places are kind of experiencing. Our EMS volume continues, I think, to normalize a little bit. At least at Penn, where I work, our ED volume still seems to be kind of fixed at about maybe 20 to 30% lower than our baseline last year. But I anticipate with time that'll come back to normal as well.
Okay.
But now we're just waiting for the next shoe to drop.
Okay, got it. And then this brings me over to Lakshmi over in Atlanta. Lakshmi, anything new to report, especially after the fun you've had over the last week there?
Nothing new. Actually, we've had continued protests all through the week, and they're planning on for this weekend as well, but everything has been peaceful, thankfully, so we're good. I mean, nothing since the last conversation we had, so I'm
okay,
good.
All right. Well, I'd like to take this opportunity as a quick break in the disaster, so to speak, and welcome and congratulate, as you all did, Vera Vinolani, who got appointed as the full-time as opposed to interim medical director for Fort Worth, and just wanted to congratulate him with it. And I liked when Joe Hawley said, "Congratulations, Beer, B-E-E-R." That was really cool and really appropriate because, you know, and so thank you. So that means he's going to buy you a beer sometime, Beer. Okay.
Sounds
so
good.
congratulations to you. Okay.
Appreciate it.
So what did it take to get that done? Did you have to submit a large amount of money or what?
So actually, most people don't know this, but after what happened with Neil, we actually rewrote our founding laws that started our EMS system here. So that took the past 20 months to actually get it rewritten and pushed through city councils and everything else. And so we're actually still waiting on some of our member cities to pass it in the next couple months here. But that's actually literally what we did. We solidified the reporting structure of the medical director and the staff.
Yeah. So the cool part is that you may have the award for the longest interim person, right? What's it been? How long has it been?
It was 20 months, 20 months. Definitely at MedStar, longest ever. Yep.
That's great. Well, congratulations, everybody. Sort of hasn't known that, Greg, but I wanted to take an opportunity to say it publicly in front of everybody else. Tom Collins, let's jump up to Cleveland and see what's happening in your neck of the woods, as they say. Okay.
Well, thanks, Paul. We're really having the same concerns and struggles that everybody else is having. We're going to be meeting with all the paramedic programs to work on how we get the students back on, because we have a number of agencies that are quite short right now on staff. We need to get these young men and women graduated out of their programs.
Yeah.
But ED volumes are creeping up. Like everybody else, we've covered from the first phase of the unrest last weekend. Only had one of our SUVs destroyed. Other than that, we're doing okay.
What? I'm sorry, I didn't hear that. One of your what destroyed?
SUVs.
Oh, SUV. Sorry. Okay, got it. Yeah. Okay. All right. Well, then, okay. So otherwise, then that sounds good. And you're healthy and well, it sounds like. And so I'm glad to hear that. Why don't I jump over to Stein? I know it takes you a while to get on the line, Stein, to unmute, etc. But you've been doing a great job keeping up with some of the website issues for us and all that. We wanted to thank you as well. And so anything else you need to report on from your end of the state?
No, actually, I got unmuted very quickly there. No, as far as we're making one last push to everybody to please give us your cardiac arrest and death on scene data so that we can put that together with you, Paul. Yeah. And as far as Colorado is concerned, we're still seeing a bend in the curve, and the numbers of reported cases are going down at the moment. We had a spike just over the last day or two, and we'll see if that's the beginning of the results from the reopening a couple of weeks ago. But things are going pretty steadily, and EMS traffic's going up and hospital visits are going up. And we're fighting the same battle of unknown with our PPE, trying to challenge pressures to downgrade on the EMS side.
Got it. Hey, so, I mean, you probably keep in touch with Kevin. Unfortunately, Kevin lost his father, and he's sort of out of commission here for a little while. And
Yes.
anything about what's happening in Denver, or things look about the same?
Denver had some riots. They did put a curfew in Denver, as well as Colorado Springs. The Colorado Springs has been lifted. I'm not aware that Denver has been lifted yet. These certainly are not as big as other places in the country, but over the last few days, it seems to have leveled out and decreased a little bit.
Got it. Okay. So, hey, David Purse, I'll give you a second or two to unmute there. And so for those of you who may or may not know David, so David has been, we'll have to go over that. Say 1996, that gives you almost a quarter century in as the Director of Emergency Medical Service. But David's also the Public Health Director there. And David, you weren't on earlier, but we gave you an award, which was the I'd Rather Be Sailing Award, as you know, for the work you're doing. So you've got several things going on. One is not only dealing with the COVID epidemic, but also the issues of some of the recent, protests and so on. And then now also the funeral there. So it's it sounds like a little bit of a challenge. How's things going for you? You handling it okay?
Yeah, so as we speak, the funeral is occurring right now. And yesterday was a public viewing, and that went off very smooth. We really had no civil unrest associated with that yesterday at all. It's hot here. So we have a lot of heat-related emergencies, but we were well prepared for that and kept that to a minimum. But on the bigger scale, it sounds like, and I'm sorry I got on late, but it sounds like we're dealing with a lot of the same things. Our hospitals are filling up again. We are seeing an increase in the number of COVID admissions. Testing is becoming more widespread, but more concerning is the percent of persons who are testing positive is going up. So as we're testing more people, I was kind of hoping that the percentage would start to decrease, there'd be some dilution, but instead the percent positive is actually increasing. And now the numbers aren't huge. We're going from the 3% range to the 5% range, but nevertheless, it's a steady, it's been about a 2-week gradual. We calculate that every day, and it's going up. Hospitals are about 2 weeks with the hospital admissions. COVID positive is going up. We did have a little bit of a quirk in that was missed by a lot of folks, but we in the health department picked up, is that the number of PUIs was dropping while the number of admitted COVID patients was going up. And what that really was is that the turnaround times on the labs was getting better. So somebody, instead of being a PUI for 7 days, they're only a PUI for 3 days until they became diagnosed, got switched over. But that seems to have leveled off, and the numbers of admitted patients are going up. The Texas Medical Center as a group, up until yesterday, was predicting the ICUs would be full in 2 weeks. Now we had a little bit of a leveling off over the last couple of days, and my fear is that's just the weekend effect.
Yeah.
And now this morning predicting it'll be 5 weeks before the ICUs are full, but my fear is that's just because on Sundays, there's less reporting that occurs on Sundays, and it generally takes us to Wednesday to get that straightened out again.
Yeah, I see.
We'll see. Yeah. It sounds like we're doing all the same things everybody else I'm hearing.
Yeah, so it'll be interesting to do tracing even on the people who are protesting. As Mike Gosterholm was on, and he and I had talked about this over the weekend, everything from shouting out loud, next to each other, and then also, coughing when you get hit with the, the, what do you call it, spray, the, whatever, the, you know what I'm talking about.
Tear gas.
Tear gas, yeah, exactly, thank you. And so on. On the other hand, there are people who say that when you're out in the open air, it doesn't get spread as much. I think it's probably somewhere in between. The truth is really pure and never simple. So it will be interesting to see how that does turn out and how this adds to it all, and so on. So, all right. Well, David, thank you for all the work you're doing, and just hope you do get out. You still have your boat, by the way?
No, unfortunately for all of you, it is no longer for sale. After 2 years on the market, somebody wisely bought it and fixed it.
Well, I hope you at least get away sometime soon, all that, but I think it may not be sooner than later. So we'll see. But thank you, David, for an outstanding job. And what it's been now, 24 years on that position there? There we go.
Yeah, 24 years with EMS, and I think it's 16 years with public health.
Yeah, yeah. Okay, got it. Oh man, good for you. You've been doing a fantastic job there. All right, let's see. Hey, Meg, I might as well go talk about humidity and heat. We'll move along. And that's one of the messaging I've been doing lately, particularly down in our area, because people are going to go out. We make sure we use a buddy system. We've been trying to promote that because, because the first symptom you might get is disorientation. So it's good to have people watching out for each other and as they go out and do this. And Meg, how about over you? Is it getting hot and humid there as well, over in New Orleans?
It has been hot and humid here. We just had a rainstorm as part of Tropical Storm Cristobal.
Oh, yeah.
And so thankfully we didn't see the flooding or destruction as much as we thought we would. So that kind of cooled things down a little bit. But it has been pretty hot here. Yes.
Oh, okay, got it. All right, but anything new then from your end, just sort of percolating along okay, right?
So we're continuing on okay. We've had no new cases today in New Orleans, thank goodness. We are hoping that we don't see a spike in the next few weeks. I think we're all holding our breath a little bit to find out if we will see the effects of having everyone in one place marching through the streets together will lead to a spike in COVID. But yeah, we're hopeful that we'll continue to have our social distancing work. All of the pictures that I saw from the protests in New Orleans, we did see everyone wearing masks, thank goodness. So we hope that that will give us some protection, but we're doing well. Thank you so much.
And thank you for your time last night. That was really a cool conversation. I really appreciate it. Okay.
It's always a pleasure talking to you, Paul.
Good. Let's skip along I-10 and go out to Phoenix. Gamer, anything happening out there?
Well, actually, quite a bit, Paul.
Okay.
I think that Arizona provides kind of a cautionary tale about reopening. As you and perhaps others are aware, we had sort of a stuttering reopening over the days May 8th through May 15th. And last week it started to be published that volumes of ICU patients and patients on ventilators have gone up and up and up, and pretty much the largest hospital chain reported that pretty much all of their ventilators and ICU beds are taken up now, and the 9 ECMO units available in the Phoenix area are all being used. So last night, the director of the Department of Health Services came out with it wasn't a directive, it was a suggestion that if your ICU capacity at any given hospital is approaching capacity, then you might consider rolling back the ability to perform elective surgeries. So that hasn't elevated to the level of a gubernatorial decree yet, but I think that's maybe the next thing that happens. So I think we can definitely classify ourselves as being in the middle of a spike. From the standpoint of the Phoenix Fire Department, we have a robust training program, and we're trying to figure out how to get 40 people per class wedged into a couple of classrooms that we can do sort of simultaneous audiovisual participation by all at one time, and that's kind of become a bit of a nightmare. Also, the fire department has been engaged by our public safety partners, the police department, in helping out on the front lines in the continuous protesting that's going on. Phoenix is now into its 11th day. This has kind of been stoked by a cold snap that we've actually had in the Phoenix area.
Down to like what, 95?
Arctic blast in every sense of the word. Our daily highs are 97, which is unfathomable. It gets down in the 70s at night, but
wow.
But we're back up to 109, I believe, on Thursday. So maybe that spells the end of the protests. But we gave, last count, 1,300 liters of IV fluid to police officers as they were shuttling back and forth from the front lines.
Okay. Hey, listen, I'm going to have to wrap up here pretty soon for everybody, but I think there is a quick report from the state of Florida that I got to get from Ken Shepke, and congratulations again, Ken.
Sure.
Yeah, and I apologize to everybody else if I didn't get everybody else on, just because of, well, we talked to most of the people within the last week or so, so that's good. So Ken, do you have some parting words for us then?
Yeah, just real quick. We're starting to see some trends on this thing. You know, we've been open since May 4th, so we've been a little over a month. And we're starting to see that there are certain areas that are going down. There's a couple others going up. But one of the things we're seeing, especially in the areas that are starting to go up, the average age of the folks that are getting this seems to be dropping. So it seems to be the folks that are at highest risk. They know at highest risk. And they seem to be, at least if the stats are telling the truth, and it's a little early to know 100% for sure, looks like those folks are still ducking and covering, and the folks that are getting this are not filling up our hospitals. So that's some good news there.
Yeah. And so, again, maybe going back to a little bit what I was commenting on before, that one, the people that know they're vulnerable and, you know, whatever, the older people that you have in your state are still paying attention to it a lot. And, you know, maybe their behaviors have changed, and maybe the general behaviors have changed, even though there's a lot of people who clearly are just sort of out there thinking everything is okay again. And it may be in the younger population. So that's kind of interesting. So we'll see how that goes. But the good news is they'll probably tolerate it better. Unfortunately, some will die, but you know, we'll see how it goes. Okay. Anybody else out there want to say something before I shut us down here? We'll meet again next Tuesday. Anybody else have anything they want to contribute in, or of importance to us all, or not important to us all? Something, as I said, non-essential. Okay. Anybody else? If not, then let's, and again, apologies to the people that I didn't, Chris, did you want to say something? Or are you just tapping on your thing there?
I'm trying to think. Sorry about that.
Okay, got it. No problem. Hey, any parting words from Jim Augustine or from Craig Manifold, who host this meeting? And again, maybe some parting words about how this would have been our first day of Eagle Creek.
Yeah, this Manifold is a little bittersweet that we're not able to be together in person in Florida to enjoy a really great meeting face to face. But our alternative and the information we've been able to share over the last few months has really just been wonderful. And so I'm really glad that we're able to come together, share the information as we have for the betterment of our citizens and our communities. And today was really particularly rewarding to see the awards that we've been able to share with our colleagues and have a little fun and laugh and smile a little bit from what we have as a day-to-day, a pretty serious job, but we're able to enjoy one another's company, learn from one another, and really benefit from everyone's knowledge that's out there. And so again, Paul, thanks for your leadership, putting things together at 4 o'clock in the morning, and everybody else who participates. It's really a great thing to be part of. So thank you.
That's good. And then I wanted to personally, again, thank people like John Kramer and Sandy Schneider, who are off the line, and Jerry Meltzer, and the multiple people that have contributed to this in such a terrific way to make everything better for us as well, and making sure we had great liaisons in important areas of the world, including mass gatherings or the federal government or our professional organizations. And so thanks for your contributions as well. So with that, I will retreat back to the Emerson, Lake and Palmer theme. That's, by the way, if you had, as I said, if you had driven in Monday night into the what do you call it, the Hard Rock Casino, you would have seen overhead that same theme. Welcome back, my friends, to the show that never ends. So we'll see you next Tuesday. I'm going to go ahead and, right for now, we'll continue on Tuesdays. Okay. All right.
Take care, everyone. Thanks, Paul.
Thank you, Dr. Paul. Appreciate it as
Thanks.
always.
Bye-bye.
Thanks, Paul.
Thanks. Bye-bye.